Hi, everybody, and welcome. My name is Neil Seidman, and I'm the co-chair of the Public Education Committee for ADAA. That's the Anxiety and Depression Association of America, and we're really happy to present this webinar, Our Kids' Anxiety and Depression, and our presenter is Dr. Andrea Umbach. We're going to be recording the webinar so you can see it again at a later time on the ADAA website. Now, during the webinar, you can type in your questions. If you look on the right side of your screen, you should see a Q&A panel. And there's a little field at the bottom of that panel. And when you click in it, you can type in your question. Then either hit your enter key or click the icon. And we're going to try to get to as many questions as we can at the end of our presentation. And also keep in mind, other participants in the webinar cannot see your question. Only myself and Dr. Umbach can see your question. Okay, so before we begin, I'd like to just say a little bit about ADAA. That's the Anxiety and Depression Association of America. ADAA was started back in 1979. And today it's the leading nonprofit organization in the field of anxiety disorders and depression. Our mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, practice, and research. We work to end stigma and to get the word out that these conditions are real, serious, and treatable. I want to invite you to visit the ADAA website. It's really a wonderful resource. It's adaa.org. One of the great features is called Find a Therapist, and there's just a wealth of information, so it's really worth visiting the website. And also you can support ADAA by making a charitable donation on the website. Okay, so I'm really happy to introduce our presenter. Dr. Andrea Umbach is a psychologist at Southeast Psych. That's a large group practice in Charlotte, North Carolina. Her areas of specialty include anxiety disorders, hoarding, and sleep. She has trained under experts at the Anxiety Disorders Center in Hartford, Connecticut, and the Behavior Therapy Center of Greater Washington in Silver Spring, Maryland. In 2012, Dr. Umbach was honored with the ADAA Clinician Trainee Award. So let me turn it over now to Dr. Andrea Umbach.
All right, thank you, Neil. I'm really excited to be giving this presentation for ADAA. Our topic today, as Neil said, is going to be our kids' anxiety and depression. Again, if you have any questions, feel free to type them in as I'm going, and then hopefully we can get to a lot of them at the end. And I'll try to do some as I go if I'm able to. First, I want to just cover our objectives for the presentation and what I'm hoping to cover and discuss with you this evening. One is just to look at the diagnostic symptoms of anxiety and depression, so what that looks like in general for most people, and then specifically what it looks like in children, so what we expect to see in kids. And then lastly, I want to try to spend the most of our time thinking about strategies and things that you can do as a parent to help support your child that might be struggling with anxiety or with depression. So I'm going to go as quickly as I can through the diagnostic information so we can get to the good stuff. To the really good strategies and all of those things I'm sure you all are hoping to hear. So I might talk a little quick at the beginning, but remember, again, this will be posted on the website so that you can get that information again if you need to. So first, just to talk about diagnosis, psychologists and people in the mental health field, we use this book. It's called the Diagnostic and Statistics Manual to determine these diagnoses. Basically, it's just a book of typical characteristics, so what we normally see in people with these disorders. But we have to remember, too, that not everybody is the same. So what your child might look like might be a little bit different from a different child or from an adult. So we have to remember that when we're looking at diagnoses. Additionally, whenever we make a diagnosis, we want to we're going to be looking for, are these symptoms or the distress that's caused in the child or the adult are interfering significantly with the person's functioning? So is it creating conflicts in their academics and their social life and other areas of their life? And that's really telling us that there's something going on there. So I'm going to hit the highlights of these diagnoses and again kind of give you the highlights of when things are different for children compared to adults. So the first one that we're going to talk about is called separation anxiety disorder. This is the one anxiety disorder that is characterized under our childhood disorders. And as you can see on the slide, again, this is having a lot of distress when we're separated from an attachment figure, usually the parents. They're going to really worry about harm coming to that person or losing that attachment figure, being separated from them. This might mean that they're refusing to go to school, they don't want to be alone, they don't want to sleep by themselves, they don't want to go to sleepovers, they might have some nightmares about separation, and a lot of times in kids we see these physical symptoms come up in them, so headaches, stomach aches, and things like that. Usually when we make a diagnosis, this has to have gone on for about 4 weeks in duration, having these symptoms. And we have to remember, though, that children might have difficulty expressing kind of this worry or maybe even deny that it's happening. So sometimes they have a hard time talking about it or really expressing that they're feeling this way. So we have to kind of look for these symptoms in them and see if this is what's happening. So that's our separation anxiety. Another one that we frequently see is called generalized anxiety disorder, or sometimes people will call it over-anxious disorder. Again, this is one that can be diagnosed in adulthood or childhood. It's excessive worry. So we really think about people that are worrying a lot about a lot of different topics. They're usually everyday common topics, but they're just worrying a lot about them and about a lot of different things. This has to be happening more days than not for at least 6 months. So that's a lot of worrying going on. And they also express kind of like a difficulty controlling the worry and feeling like the worry is kind of taking over. Specifically in kids, the worries are going to be related to like performance situations, feeling competent in school and sports, health issues, there being some type of catastrophic event, and especially safety. So these are what we usually see more in kids, where in adults we might see some other kinds of worries. We might see some perfectionism in these kids, some just being excessively like not satisfied with themselves or with other people, and maybe even some like redoing tasks to make sure that they're done well or that they're perfect. A lot of times in these kids too, they seem just very unsure. So unsure of themselves, unsure of the world, unsure of people, and a lot of just wanting approval and reassurance about everything that's going on. So again, this can be in adults and children, but it looks in specific ways when we're thinking about children. These are the things that we're looking for. Another area is phobia. So we have specific phobias and social phobias. What we see is just a persistent fear that's just excessive or unreasonable, and this fear is stimulated by being exposed to this, the stimulus of some kind, and we have an immediate response, like a fear reaction. And usually when this happens, we'll try to avoid the stimulus, or we'll get through it with a lot of just distress or problems. A specific fear is usually something we're afraid of, like one thing. It might be like animals or heights, have a fear of blood. I know I have a lot of clients with a fear of vomiting, things like that. So it's usually a very specific fear. A social phobia is usually going to be related to like performance types of situations, social interactions, and this usually has some type of fear of being judged or humiliated when they're in these types of social situations. Specifically in children, this anxiety might be seen. You might see crying, tantrums, freezing or clinging in your child. And also with children, we have to recognize again that they might not see this fear as excessive. Like they might see it as, oh yeah, this is normal. I'm supposed to be totally terrified of bees. But in reality, we're thinking, well, it might be a little excessive. This is not the way all children would react to this stimulus or to this experience. Again, it has to last about 6 months for us to kind of consider it a disorder, or a diagnosable disorder. And specifically in social phobia, we're probably going to see some type of decline in academic performance. You might see school refusal or even avoidance of like age-appropriate activities. Again, this is related to just fears that they have about being in these types of situations. Then we move to obsessive compulsive disorder. So again, there's some type of obsession, and we think of that as like a repeated kind of intrusive, distressful thought. It can also be an image or an impulse, people might describe it as. And usually it's followed by some type of behavior, or it could be a mental act that's basically reducing the stress. So I'm going to do something in the moment to make myself feel better, and we think of that as a compulsion, like a repetitive behavior. These compulsions and obsessions usually have to be time-consuming, so it's usually about more than an hour a day and cause significant distress. And specifically in children, the washing, checking, and ordering rituals are the most common. There's a lot of other rituals that we might see in adults, but these are the ones we're more likely to see in children. The children especially might not see these compulsions as a problem because in the moment the compulsions are making them feel better. So they're saying, I'm doing this, so I'm going to wash my hands because it makes me feel better in the moment. What they don't see is kind of the long-term problem, that this is just kind of continuing a cycle of being afraid of germs or whatever it was that prompted them to be afraid of it. The kids with OCD, we sometimes see decreased concentration and academic performance. For example, if you're constantly worrying about something or obsessed with something, or if you have a lot of thoughts going through your head that are obsessions, it's going to be very hard to concentrate in school. And lastly, related to OCD is this thing called PANS. It previously was called PANDAS, if you've heard that before. It stands for Pediatric Acute Onset Neuropsychiatric Syndrome. So this very big word. Basically what happens is sometimes before puberty, we see kids that have just like this acute onset of OCD type symptoms, and it's brought on by like a neurological abnormality. So sometimes we've seen it linked to strep throat, Lyme's disease, things like that, where it's triggered in some way, and we'll see this really quick onset of OCD type symptoms. And that's usually before puberty. So if you're seeing a quick onset like that, that might be something to consider, or we usually make sure we talk to a medical doctor to see if that might be a possibility. Post-traumatic stress disorder, again, this is experiencing a traumatic event. When we experience a traumatic event, there's going to be fear, helplessness, or horror, some big reaction. The event is likely to be re-experienced. It can be through dreams or flashbacks, things like that. And we're usually going to be distressed if we're exposed to some type of cue or trigger that reminds us of the traumatic event. We're also likely to avoid those triggers, avoid those things that might be a cue for us, or just kind of detach from things in general. Also, we're likely to have like an increased arousal. So we might have a startle response or be hypervigilant about things. That's because of the traumatic event. Specifically in kids, we might see more of a disorganized or agitated behavior. We might see repetitive play or like reenactments of the trauma, something that, they're trying to express what happened, but it's hard for them to maybe to do it verbally. They might have frightening dreams. That's a possibility with kids. In older adolescents or older kids, we might kind of hear them saying things that might be related to like a sense of the future being short, or they might not have as much interest in the activities they used to like, in addition, again, having some of those physical symptoms. So a lot of these disorders, again, there's commonalities between what kids experience and what adults experience, but sometimes we have to look specifically in kids for other types of symptoms. One disorder that's pretty similar between kids and adults is panic disorder. So panic is basically when you have a panic attack, which is kind of these physical symptoms. So it can be increased heart rate, shaking, having trouble breathing, all of these physical things that happen to us when we're panicked. And with panic disorder specifically, after the panic attack, there's usually this additional fear of having another panic attack, worrying what's going to happen if I have a panic attack, or changing my behavior to make sure a panic attack doesn't happen. So it's highly focused around like what's going to happen if I'm going to have a panic attack again. And children and adults seem to experience this in the same way. Again, everyone's different. Their physical sensations might be different from the next person, but there doesn't seem to be a lot of distinguishing factors between adults and kids in this area. So you might ask, okay, so how do I know if my kid has anxiety, or how do I know if my child is anxious? This is a lot of information. So basically what we're looking for is some type of emotion. Kids might use different emotions for anxiety. So they're not going to all come in or come to you and be like, I have anxiety. They might say, I feel restless, I feel on edge, I'm frustrated, I'm scared, I'm afraid. So you might hear different words that don't necessarily sound like anxiety, but it might be that's just the way that they're expressing it. In terms of thinking, we might see some more pessimism in these kids that have anxiety. They may have a negative view of the world or of themselves or other people, a lot of exaggeration about what's going to happen, what might happen, and again, maybe some perfectionism. We also might see some hypervigilance, again, paying attention to things, being very aware of the world around them and what's going on, or even some difficulty concentrating because they are so worried or so anxious. In terms of their behavior, you can see physical complaints, again, that we talked about, muscle tension, meltdowns, tantrums, crying, all of those things. A big one is going to be avoidance. If we see avoidance behaviors or they're withdrawing or limiting their activities in some way. And also if they're looking for reassurance from you or from other people, or they're trying to really control certain situations so that they make sure they don't get anxious or they don't have to feel uncomfortable. We also see with kids with anxiety, they might have some eating issues, some sleep disturbances, or some fatigue. So those are pretty general, especially if we aren't feeling well or feeling anxious. Not surprising, those areas would be affected. And lastly, in the older kids or teen area, we might see some drug or alcohol abuse. I think a common one is just, using alcohol or using a drug of some kind to make them calm down. Like sometimes teens or older kids will go that way. So the prevalence of anxiety disorders, this is looking at how frequently this is happening, and this was a study that was done recently, and it was specifically on teens, so not necessarily on young children. But 25.1% of teens have experienced an anxiety disorder. So we're thinking a quarter of these teens have experienced this in some way. And what we see is that females seem to experience this more frequently than males. But across the teen ages, so anywhere between 13 and 18, it seems to be a pretty similar level. We don't see a lot of differences. So that's a pretty big number, and we're going to compare that to the numbers in depression in just a minute. So we're going to move on to depression, again, the diagnostic categories. For major depression to be diagnosed, again, we're talking about adults and kids, we're looking for at least 5 symptoms that are listed there. And they have to be happening within a 2-week period for nearly every day. So these symptoms, again, can be depressed mood, loss of interest, difficulties with sleeping, feelings of worthlessness. We might have some suicidal type thoughts and feelings in there. So we're looking for quite a few symptoms that are in this category. Specifically in kids, we are more likely to see irritability, so an irritable mood, than a depressed mood, which is actually pretty interesting because a lot of times there's a misconception that, a kid has to look sad in order to be depressed, but sometimes we see it differently. Sometimes it looks irritable. It looks a little bit different. Also, children tend to have more physical complaints, irritability, and social withdrawal. That's what we usually see in depression, as opposed to adolescence, where we might see more of this, we call it psychomotor retardation, which is basically slowing reaction. So whether it's a physical, an emotional, or a cognitive reaction, it's just very slow, and things are harder than they used to be. We also might see hypersomnia more in adolescence, so this is sleeping a lot, being overly fatigued, those differences we see between children and adolescents that are depressed. Then we move on to something called dysthymic disorder. This is basically, you can think of it as like a chronic depression. So this depressed mood has to be, for adults, more days than not for at least 2 years. For kids, it's going to be 1 year. Again, we have our list of symptoms that we have to have at least 2 of those following symptoms. For kids, again, we're probably going to see more irritability or crankiness. It only has to last 1 year compared to 2 years for adults. And we're probably going to see, especially with these kids, some academic difficulties, probably not a lot of social interaction, low self-esteem, possibly some poor social skills, and some pessimism going on. So again, it's similar to the adults, but there's some distinguishing factors for kids. So again, how do we know if my child is depressed? What would I be looking for? Irritability is going to be a big one. Sensitivity, again, hopelessness and guilt. We could see anger, frustration, and just kind of a lack of like this desire, motivation, enthusiasm, those types of things. In terms of thinking, we're going to probably see some low self-esteem. A lot of times these kids kind of just feel like this is going to last forever. There's just this pessimistic view of things that are happening, and of course a difficulty concentrating when all this is going on. In terms of behaviors, where you might see some acting out, again, not all kids will act out, but it's possible we would see some acting out behavior. Decreased socialization. We can also see those physical complaints or just not taking care of themselves very well, you know, not really exercising or doing the things, eating well, doing the things they should be doing for themselves. Wouldn't be surprised if you saw some decreased grades. Some kids will go to the length of skipping school or not wanting to go to school. In depression, we also usually see decreased appetite, increased sleep, fatigue, and low energy. And again, we get in the area of possibly some drug or alcohol abuse to make themselves feel better. And lastly, the same with adults. We could possibly see some suicidal thoughts, plans, or attempts if the child is severely depressed. That is possible. So we go to our numbers. Again, the same study was looking at teens and the frequency of the depressive disorders. And basically we see that about 11% of teens will have experienced a depressive disorder. Again, we see that the females are more likely to experience it than males. And there was actually a new study that came out that said that 2-to-1 kind of difference is what we see in adolescence, but actually before puberty it's pretty equal. So we kind of see a shift once kids hit puberty. And we can also kind of see this in the ages that the older the child gets, the more likely it is that they're experiencing those depressive symptoms. And again, this is likely due to just developmental changes in the brain, difference in environmental stressors, a lot of different things happening, very different between a 13-year-old and an 18-year-old. So how do I tell them apart? So as I was talking, you're probably like, this all sounds the same. Not really sure what the difference is between anxiety and depression. So let's think about what's the overlap and then how are they distinguished. So the overlap, again, we're seeing negative affect in both anxious and depressed teens, a lot of irritability, difficulty concentrating, this negative just bias or pessimism, low self-worth, and then, of course, difficulties with eating, sleeping, and fatigue. So those things we're seeing kind of whether the child is anxious or depressed, it's likely that we can see those symptoms in all of those kids. What distinguishes them specifically for anxiety is we're more likely to see this like hyperarousal and hypervigilance. So there's a lot of awareness of what's going on, whether it's awareness of their physical sensations, awareness of what's going on in their environment, and restlessness and tension, those types of things. And the avoidance of things is going to be due to fear. Again, it's not due to lack of caring or lack of wanting to do something. It's usually due to fear, due to that anxiety. And again, we're going to see worrying about a lot of different issues. In depression, we move more towards this feelings of being unloved, having some guilt or despair type feelings, just very low, positive affect. And then usually a lack of pleasure or low interest in activities. So again, it's not related to fear. It's more related to just lack of interest or not having the energy to do things, just not feeling pleasure as much as they do. And then even some difficulty with daily tasks that they did fine before, but now they're struggling with completing. So that's usually what distinguishes them. In kids with severe symptoms, it's easier to see these distinctions. When symptoms are mild, it's more difficult to kind of see the difference because we're usually going to end up with a lot of that overlap. There might also be situations where the child is experiencing both, where they have anxiety and depression. Again, it's not uncommon. That can definitely happen. And there's also these kids can have other types of disorders. So it's possible that you could have anxiety and ADHD, or you could have depression and conduct disorders. So again, we have to remember that there might not just be one thing going on. There's possibilities that other things could be happening as well. So why is this happening? Why is my child experiencing this? What's going on? There's a lot of different theories out there, and this is basically the general theory of why we think certain disorders come about. Basically, there's some type of vulnerability that exists. It can be biology, and basically this is having different levels of neurotransmitters, things like serotonin, dopamine, things like that. And we have paths of nerves in our brains and our bodies, and if we have the right balance of neurotransmitters, everything goes pretty well. However, at some point, there can be a misbalance or an imbalance, and that makes it so that our neurotransmitters create like a misfire. So what happens is resulting anxiety or possibly depression because of the imbalance in our neurotransmitters. Luckily, treatment and medication can help with this, and it can help get us back to a good balance. But this is one piece of the puzzle. We might also have a genetic vulnerability, so we might have inherited, depression or anxiety if it runs in our family. We might have inherited it, or we could have inherited a certain temperament. If we have difficulty just regulating emotions, we could also just be more sensitive. So there's a lot of different characteristics we could have inherited that have created this vulnerability. And those things usually interact with our environment. And again, depending on that interaction, it kind of determines what are we going to end up with. Are we going to end up with anxiety, or are we going to end up with depression? And it's along a continuum. So some kids might be more mild, and then we move all the way to the severe cases. So just because we have some vulnerability, or just because we have some stressors in our environment, doesn't necessarily mean we're going to end up with severe depression or severe anxiety. It's a continuum. So we have to remember that there's different levels of this. The environmental things could be, just about anything. It can be, being bullied. It can be a big move, changing schools, being overscheduled, having too many things going on, a loss. There's a lot of different things, health problems that can create that environmental stressor. I think one of the most important messages, especially for parents, is that it's really no one's fault. There's a lot of different things coming into play here, a lot of different factors, and a lot of things that we don't have control over. And just as much as it's not your fault, it's also not your child's fault. There's a lot of reasons why a lot of pieces of the puzzle that had to come together in order for your child to experience these symptoms, and a lot of it, again, isn't really under our control. So the most important part is where should I focus my efforts? How can I help my child? What can we do now that we're seeing symptoms, or that we're getting a little concerned that these things might be happening? This is just a basic chart about the different pieces that are involved with anxiety or depression. Usually there's situational factors. There's our thinking that's involved when we're anxious or depressed. We have these physical sensations and emotions that we experience, and then we determine what our behavior is going to be. So out of these four categories, one thing that we don't have a lot of control over is going to be the situation. Sometimes we feel like we have control, but honestly we can't always change our environment, and we can't always change the situation. So what we're going to be focusing most on is our thoughts, our emotions, and our behaviors, and seeing how we can help your children, how we can help them in these three other categories. So early intervention is going to be really important. Again, the more informed you are, so just the fact that you're listening to this presentation is amazing. The more informed you are, the more information you're going to be, the more supportive you're going to be for your child. Again, what you want to do is have predictable routines with clear expectations, but also with some flexibility. So I think some people think clear expectations means I have to be a drill sergeant, but we also want that flexibility and to go to model that to our children. We want to remember to have healthy and balanced living. And again, if there's any underlying issues, so for example, if there's a learning disability, or if your child's being bullied, if there's something going on that needs to be addressed, you need to make sure you do that and not just ignore this underlying issue that might be part of the stressor. Something you might have to do is determine your family's values and priorities. So for example, are straight A's our priority? Is that something that we need to be focusing on, or is there something else that's more important to us? In addition, knowing your child's strengths and weaknesses are going to be really, really important. And also really being honest about your expectations, and are these realistic for this child? So what you expect from one child might not necessarily be the same expectations that you'd have for another child. So we want to keep these lines of communication open between, family, but also with the teachers, if the teachers are involved. And ultimately, it's going to be taking care of yourself so that you can be a supportive person for your child. So these are just some general, just early intervention things that we have to kind of be honest about and say, are these things that we're doing well? So when we move to helping our kids with emotions, there's a lot of different things we can do. So one is being positive and realistic. So giving them encouragement that's positive and realistic. So again, there's a difference between like, hey, you can go do it and you can get first place, versus, hey, you can do it, you can get through the race. So there's a big difference there between I'm being positive in both of them, but in one I'm being more realistic than the other. We want to give lots of praise and rewards, and we specifically want to praise effort and hard work, and not necessarily, again, what the ultimate goal or prize is, but specifically their effort and that they're trying hard and putting in their best that they can. Sometimes it's helpful to remind kids of their past successes. So when were times where you got through something difficult, or how did you cope with this situation before when it was hard? And reminding them that they got through stuff, that they did a really good job, and that they've been able to overcome some of these obstacles in their lives. We might have to teach our kids an emotional language. So for example, they might not have the words for their feelings, and they also might not have the words to describe what their body feels like. So you might have to help provide them some of those words and talk that out. For little kids, they might need like a signal sometimes. So especially if they're in public and they can't really describe what's going on with them, they might need to give you a little signal that kind of tells you, I'm feeling anxious, or I'm not feeling good right now. You can even use a scaling system. So say from 0 to 10, tell me how you're feeling right now. So 10 being the worst, 0 being, I'm feeling really good. Just have them give you a number so you kind of have this communication about how they're feeling. Again, open communication is going to be about allowing your kids to discuss maybe scary things with you or difficult things with you, and not overly reacting or not reacting in a really negative way, because they need to know that they can talk about hard things and that you're not going to freak out or you're not going to have a really bad negative reaction. So practicing that skill in yourself, that I can listen to my child say hard things, or I can listen to my child talk about the fears that they have, and I'm not going to have a really big reaction. We want to validate how they're feeling. So again, if your child comes to you and says they're not feeling good, we want to validate that and explore it a little bit more. And we really want to practice asking questions and listening instead of providing answers and fixing. So a lot of times, if we just listen, kids can figure out solutions on their own, and they can problem solve on their own, and we can support them in that instead of doing it for them. So that's going to be a huge one, is making sure you're listening and validating and not really always focusing on fixing them, but helping them through it. Journaling is a great resource. So just encouraging your child to journal, or you can journal together. I know I have some families that, the mom will write something in it and slip it under their pillow, and then the kid will write something in it and slip it back to mom, and that's the way they're more comfortable communicating. So sometimes it might be hard to talk about it, but they're willing to write it. So that might be a good resource. Also, we want to help kids with mastery. We want them to feel good about themselves, like they can accomplish things. So you might have to help them think of things. What can we do that's going to make you feel accomplished? What can we do that's going to make you feel successful? And you helping them come up with some of those activities. And just encouraging activities in general, coming up with family gatherings or coming up with ideas and helping them get involved or socialize if they need to be doing that. And specifically having special time together. So we know we're all busy and we have a lot going on, but finding that special time, if it's just one-on-one time with mom or dad, or having special family time, that's set aside and it's something they can look forward to, and it's consistent so that they know that it's happening. We also want to have problem-free talks and problem-free activities. I had a kid come in and tell me once, and he's like, every dinner conversation is about my anxiety, and he just felt horrible. He's like, I'm sick of having this be the focus all of the time. So making sure that there is time when it's not always about the anxiety or the depression. We have times when it's problem-free time. You also need to be focusing on modeling healthy coping behaviors with emotion. So think about, how do I react to things when things are difficult, or if something comes up that's unexpected? How do I react? And am I modeling healthy coping behaviors for my children? And if I'm not, what do I need to be doing to kind of make sure that I'm exploring that area, or make sure that I'm working on that for myself? And especially practicing these skills together. So it's way easier to say, hey, let's do something, and let's do it together, than, hey, why don't you go do this and practice it on your own? So practicing these skills together. And lastly, you want to give your child an opportunity to make choices. This will help them feel like they're more in control. So anytime that you can have them help make choices, or have them feel included, that will be really helpful. So this slide is just a general big category of different types of coping strategies. First, you want to identify what coping strategies your child currently has, and you might be surprised. I think a lot of times we assume our children know how to cope, but then we realize they have no idea what that means. So there's a lot of different resources here, things that you can do together. The ones you might not be familiar with is the coping box. So a coping box is just taking a shoebox or a bag or something, and this is usually for younger kids, and having them put a bunch of things in it that are comforting. So they could put in a blanket, or their iPod, or a book, or a picture of the family, whatever they need, and putting it in a place, a comfort place, that whenever they need it, they can go grab it, and they have all of these things in there that make them feel good, or really help with their emotions. Huge ones are going to be laughter, sunshine, exercise, all of these great things that we all know we should be doing, but sometimes we're not able to get to. Again, for kids that are really depressed, the last one on the list, light therapy, might be something to consider. Again, it helps with our melatonin and our circadian rhythm. That might be something to consider with your doctor. So there's, again, a whole list of things that you guys can be practicing together as a family, or encouraging to help with emotions. Helping your child with their thoughts. So one thing we want to do is practice optimism. So you can have them look forward to something. So talk about what's the next thing they're looking forward to. They can also create a gratitude journal where they're writing down 3 things a day that they're gracious for or thankful for, and then also tracking when things went well. So we're kind of moving them towards that more positive thinking. And if you notice your kid, again, has a lot of pessimism, instead of, asking how your day was and they tell you about all these bad things that happened, say, let's do 2 good things and 1 bad thing. So at least we're getting a little bit of that positive stuff. Self-compassion can be a big one. Again, sometimes it's hard for us to be kind to ourselves, so what you can do is have them visualize a compassionate person. Usually it's a grandparent or someone like that, and have them visualize what that person would be saying to them in that situation. And we also need to practice being realistic with our kids. So, for example, reminding them they don't have to be perfect, and reminding them what's really happening in the situation. So, for example, was that person in the hallway really ignoring you, or do you think that they might be a shy person too? Like, kind of being realistic about what might be happening in certain situations. And also helping them with problem solving. So thinking about, how can we break down these things into smaller bits? How can we take baby steps? What are the pros and the cons of this situation? And helping them through that problem solving, because they can't always do it by themselves, and sometimes they need a little coaching. Again, what we can do specifically for anxiety is we want to externalize this. So instead of saying you are anxious or you are depressed, we want to think more about, the anxiety is getting to you, or your depression is getting to you. And what we can do to externalize it is sometimes we write it down, and we kind of, or we tell it to the worry doll, or we put it in a worry box, or we say it to our dream catcher. And we kind of take the fears or the depression or whatever it might be and kind of put it away from us and put it away. We can also name the fear, like I had, there's a lot of different things, germ worm or worry bug or whatever it might be, naming the fear so that it's external and not internal. It's not a part of them, but it's something they're struggling with. And learning how to talk back to that thing. So you can say, leave me alone, worry bug, I'm trying to have fun right now, things like that. Or have a mantra, like a quick little thing that they say to themselves, like, I am strong, something like that they can say over and over again to themselves so that they have that reassurance or that encouragement for themselves. Worry time is another important thing we can do, is setting aside a time during the day where they have planned and limited worry. So we only want to worry for that 20 minutes, and the rest of the time we're going to let ourselves be free. And we're going to let ourselves wait until the next day when we have worry time to have that worry. So that's also a possibility. There's a lot of ways to challenge thoughts. Again, this is making our thoughts a little bit more flexible. So one thing we can do is like do the math. So what's the probability or likelihood that these things are going to come true? We want to look at the facts. So what's the evidence? What does past experience tell me? All of those types of questions. We can test it out, so we can make predictions and see if something actually comes true. So I can predict it, you know, am I going to get sick if I touch this gross germy thing, and see if that actually happens. We also want people to think on a continuum. So thinking about, again, the scale, like is it just perfect or failure, or is there something in between? So helping them realize that there is this gray area in between. Also, worst case scenario, we can think about, you know, would it be horrible if this actually happened? And if it did happen, could I cope with it? Could I get through it? And how much would I care about it a month from now? How much would it matter? Shifting perspective, I'm sure something you guys do a lot, is saying, you know, if this was happening to a friend or a relative, what would you say to them? How would you help them get through it? And then lastly, embracing the unknown, kind of emphasizing like the uncertainty of the world. So maybe this would happen, maybe it won't. Or surprises are a part of life, but I can deal with them. And sometimes it's fun to be spontaneous. Okay, I'm sorry I'm rushing through these. I just want to get through the rest of the content. So lastly is the behavior area. So we want to model healthy behaviors. This includes nutrition, eating together, not watching TV all the time, avoiding the things we know we shouldn't be having in our bodies, exercising together, showing good sleep habits, not overscheduling. So all of these things we need to be modeling and encouraging in them. Also creating connections is going to be a huge one. Having regular family time, fun time together, one-on-one or together, and make this time unstructured. It's not about teaching, it's not about, you know, learning lessons, but it's about having fun, unstructured time together. Scheduling play dates or having social activities, making sure that there's a kind of a community of connections that your child has. We don't want them to feel isolated. We want them to have as many connections or places as possible to kind of talk about things. And again, you might have to start slow and help your child warm up to these kinds of things, but it's something that you can do slowly and help them with. Emotional regulation, again, to help with our behaviors, is we don't want to do things just based on our emotions alone. It has to be also balanced with logic. So one thing that we usually say is fake it until you make it. So do things even though you don't necessarily feel like it. So for example, I really don't feel like exercising, but I'm going to do it anyway. And then once I start doing it, I'll probably feel better. Once I'm done, I'll probably feel better. Another thing you can do is start exposing to these scary situations, and this is definitely something you would do if your child was in therapy. For anxious kids, is starting small and slowly building so that their bodies can get comfortable with these scary situations. And also rehearsing difficult situations. So if they're afraid of social interactions, or if they're afraid of certain, like a test or something like that, rehearsing these things that are hard for them so they can learn how to cope. And sooner or later, we know their brain kind of catches up and it learns and it realizes that they can get through these things. In terms of behavior regulation, again, you have to set clear expectations for their behavior and also allow for natural consequences so that they can see, you know, what these behaviors, what the consequences actually are, instead of you having to rescue them or fix it all the time for them. We want to also provide appropriate replacement behavior. So instead of just saying stop doing this or don't do this anymore, we should replace it with something positive, a coping behavior, so they have something they can do. And then lastly, we want to use rewards to support those positive behaviors, again, supporting effort and supporting how well that they're doing. Then again, just to remember that there's a lot of help out there. You're not alone. You're not the only parents dealing with this. There's all these people and professionals that can be helping you. The professionals should be helping you distinguish between what's age appropriate and what actually might be significant symptoms. And again, for anxiety and depression, what research has shown us is the most effective treatments are cognitive behavioral therapy or using a SSRI. It's a serotonin-based medication. So those are areas that, again, any of these mental health professionals can lead you in the right direction of where you might be able to get that therapy or medication if that's something that you're interested in. There's resources here, recommended readings for anxiety for parents and also for kids. And again, I know the list is quick, but it'll be on the website. And then lastly, there's recommended readings for depression. And ADAA has a lot of, on their website too, of resources for reading. Okay, so that's it. Sorry it was so fast, but we want to make sure we have a couple minutes for questions if anybody has anything that they were interested in.
Thanks, Dr. Umbach. While we're waiting for people to type in their questions, how does a parent know when they should be seeking out some help? So they know their child is struggling and maybe having some of these symptoms, and the parent really is doing their best and trying to learn some of these tools. Is that a real big step to take, or is it something where they could just maybe have a consultation? What should a parent do?
That's a great question. I think usually where parents start is they do research, so they're going to do research about, are these significant symptoms? And again, if your child's not feeling good, or if they're not being themselves, or if you're noticing something's going on, there's no harm in looking to whether it's a teacher or a counselor or whoever, yes, definitely you can have a consultation and you can meet with someone and explain to them what's going on and get a good read from that person. And again, a person that's kind of removed a little bit from the situation about, is this something that's significant? Is this something that treatment would help? Is this something that could be worked on? And even just getting some advice about things to do at home, or if therapy would be effective. So again, yeah, just because you get a consultation with a counselor or a therapist, it doesn't mean they have to be in therapy forever, but it's definitely a place, even as a parent, if you need some support, you can get a lot of good information. And again, the ADAA website has a great list of therapists and people that are hopefully in your area that could be helpful. And I think, again, just seeking out that information and seeking out what's available is going to be a great first step. Yeah.
Would you suggest that a parent that's seen some of these symptoms in their child seek out one of these therapists for a consultation first, or go to the pediatrician first, or either one?
I don't know that it would probably be based on the symptoms, because usually what we see is, especially with the kids that have a lot of physical symptoms, they usually end up going to their pediatrician first because they want to know, are these physical symptoms related to a medical issue, or are these physical symptoms related to anxiety, depression? So I feel like that's usually where people start, because they're wondering about the physical symptoms if those are present. And then the physician, after they do a medical evaluation, they'll usually refer you to a therapist or someone if there isn't a medical reason for those symptoms. If those physical symptoms aren't present, then it'd probably make the most sense just to go to a therapist to get that consultation to see what might be going on. Yeah.
Here's an interesting question that came in. What is the best way to deal with an older sibling that's teasing the younger sibling when that older sibling is feeling anxious, expresses it by teasing behavior?
Okay, good question. Well, first of all, it'd probably be very difficult to address it in the moment, so I think having a discussion with the older child, or even as a family, and kind of talking about strengths and weaknesses. So we all have things that we're really good at, and we all have some things that we're not so great at, and we all kind of have some things that are scary. So maybe just having a discussion with the family about, okay, well, little sister or little brother might be afraid of, whatever, spiders or the dark or being away from mom and dad, but you're really afraid of roller coasters, or you're really afraid of bees, or you have something that you struggle with too, and kind of helping that older child realize that this, it's kind of normal. We all have something that we might be a little bit afraid of, and we want to be supportive and help little siblings, let's help talk them through it. Or if you have some really good coping skills that you use to deal with that anxiety, say, why don't you teach them? Why don't you teach them, when you feel anxious, you go listen to your music, or when you feel anxious, you go Do you go exercise or do something fun? Why don't you help them through it? And hopefully they'll develop some empathy for the younger sibling and see that this is something that they probably struggle with too. It's just in a different context or in a different situation.
Here's a question about, you mentioned this idea about worry time. Could you say more about that? That sounded like a pretty interesting idea. So if a parent has a child that is always worried and talking about worry and it's just like that's the default, how would you use that tool with a child?
Yeah. So worry time, yes, this is a great strategy for the kids that are worrying all the time. And basically what we want is, if you think about it, we're worrying all the time. We have just a lot of balls in the air. We're thinking about a lot of different things, and it makes it really hard to concentrate on what we're doing. So by doing worry time, you can set a certain time. So it might be 4 o'clock every day. We're going to sit down, and we're going to just, it's free writing. We're going to write down all of our thoughts. We're going to write down all of our worries, and we're just going to get it out. So one, just getting it out is helpful. Just, letting it out and expressing it is helpful. And then what we're doing is we're limiting the time frame. So from 4 to 4:20, whatever it might be, that's worry time. So at 6 o'clock at night, if they have a worry, they can say, oh, well, I'm thinking about this right now, but I'm going to wait until worry time. I'm going to wait until tomorrow, and I'll deal with it then. So I'm not going to forget about it, and I'm not going to pretend it doesn't exist, but I'm going to just allow myself to be free for 23 and a half hours, and then I'll have my worry time for that 20 minutes or a half hour for one day. And I've
That's going to be a long time. Can be a long time for a child to.
Yes.
What if the child doesn't stay with worrying because they get bored after 2 or 3 minutes or 5 minutes?
Well, yeah, we encourage them for them to do it as long as they can, but what we tend to notice is that if they do it consistently day after day, they do start to kind of run out of things to worry about, or they realize, yeah, I'm kind of worrying about the same thing every single day. And something you can do as a parent to help them is once they have all their worries listed, you can sit down and problem solve with them, and you can say, okay, what are there any things we can do? Do we have control over these things? Are there any steps that we should be taking, action steps? And some of them there won't be. Some of them will have to say, you know what, we don't really have a lot of control over this situation. This is something that we just have to, it's a wait and see, or it's a, if it comes and if it happens, we'll deal with it and we'll cope with it, and let's talk about how we'll do that. So sometimes it's processing it with them. If just, getting it out isn't enough, sometimes they might have to kind of think about it or challenge those thoughts that they're writing down. And again, if 23 and a half hours is too long for them, if they can't wait that long, you can do it twice a day or something like that to start. But what we normally find is that sooner or later the kids kind of get bored and they realize, okay, I only have like 4 minutes worth of worries. So if that's what happens, that's actually what we want to have happen. We want them to get bored. We want them to kind of realize this is kind of silly. I'm kind of sick of sitting here and writing these things down. Yeah.
It sounds like that can really shift the way the child is doing the worrying.
Yeah, because I think what worriers sometimes think of is that I should be worrying. By worrying, I'm protecting myself, and by worrying, I'm preparing myself. And we actually want to say, you know what? Why don't we just limit that? Why don't we keep it to this little time frame? We're not saying you can never do it, and we're not saying you shouldn't plan or prepare. But let's not have it take over your whole 24 hours. The times when you should be playing or doing school stuff or doing more enjoyable activities.
Here's a related question. You talked about uncertainty. And how do you help a child that seems very anxious about, scary things that are happening in the world or scary things that are happening to people that they know?
Yeah, uncertainty is a tricky one. I mean, it really is for adults too. And I think we want to be careful because we don't want to scare them, and again, we don't want to also have to protect them from everything. So we have to kind of talk to them about there are some things in life that we can't predict. There's things that go on that we don't have a lot of control over, and the one thing that can make them feel like we have some control is knowing that they know how to cope with situations. So they have strengths, they have skills, they know how to handle situations, they know how to problem solve. So when problems do arise or if something unexpected does happen, they have the ability to deal with it. Because if you have confidence that you can deal with something when it happens, then a lot of things don't have to be that scary. So I think the most important part is building their confidence and building up their skill level of, yeah, let's think about the times unexpected things happen, or let's think about the times when things didn't go exactly the way we wanted to, or something scary happened. Like, what did we do? How did we get through it? So that they can kind of see that, even when something bad happens or even when something unexpected happens, we can handle it and we can get through it, and I have the ability to do that.
I think we have time for one more question. Carol, here's a question about sleep. How prevalent is anxiety about sleep, and I guess difficulty with sleep, in pre-adolescent kids? And could
good question.
Yeah.
Oh, go ahead.
Go ahead.
I was going to say, good question, but I don't have the numbers or the research. I wish I did. I wouldn't be surprised. I mean, I think it's something that's probably pretty significant. I definitely have teens coming in my office that are struggling with sleep. A lot of times, if we're worriers, if we have a lot on our mind and we're anxious, of course we're going to have a hard time falling asleep. Of course we're going to have difficulties. So I wouldn't be surprised, yes, that this is definitely something that's happening.
I'm wondering if the parent isn't asking, is the onset of puberty something that can affect sleep with kids?
Well, yeah, I'm sure the onset of puberty can change a lot of things. It definitely is affecting sleep with kids. And again, we know the onset of puberty, again, I don't know if it is similar to depression, that once puberty hits, we see a big difference between depression levels. I don't think it works exactly the same thing with kids. But shifts in hormones, I mean, again, we're shifting hormone levels, neurotransmitters, our biology, all of those things are shifting. So it is possible that they become more anxious or that they have more difficulty sleeping. But again, it's going to be dependent on the child and their biology and their hormones. Is it going to happen with every kid? No. Can it happen with some kids? Yes, definitely.
One more real quick question is, if there's a family member who displays a lot of anxiety, maybe in a negative way, should I protect my child by keeping my child away from that person? Like it's going to be catching in some way, or it might be a bad role model?
That's a good question. I mean, I think you have to use your judgment. I think it's going to depend on your child's perception, too, of what's happening. If you're able to have discussions with your child, like say it's a close family member that you like to spend time with, you can have discussions with the child after about, you know what, is this the way that you would handle this situation, or is this the way that you would think about this situation? You can kind of process it with them. Again, it's going to depend on the age of the child. So you have to determine if that's something that, if you had a discussion or if you talked with your child about the behaviors of the person or the way the person reacted, would your child kind of learn from that? If you think it's really significant and this person is really modeling some horrible behaviors, I mean, you might have to just, I don't know about limiting all contact, but you might have to figure out what are the situations that are going to be a more positive situation of us spending time together than having, being in a situation where there's going to be a lot of anxiety and there's going to be a lot of these behaviors I don't want my child to see. Yeah.
Excellent. Well, thank you so much, Dr. Umbach, for a really wonderful, informative presentation. And I want to thank everybody for attending. You'll be getting an email to let you know when a recording of the webinar will be available, so you can see this information again and maybe get some more of these resources from this great presentation. Our next webinar is planned for June 5th at 7 p.m. Eastern. And lastly, consider making a contribution to ADAA so we can continue these kinds of programs and the many other activities of ADAA. So bye for now, and look forward to seeing you next time.